Let's look at older adults and suicide prevention. In this course, we're going to take a look at some of the risk factors for suicide. We will look at individual risk factors, relationship risk factors, community risk factors, societal risk factors, and then specific risk factors for older adults. We will then talk a little bit about protective factors such as individual protective factors, relationship protective factors, community protective factors, and societal protective factors. Finally, we will discuss the warning signs for suicide. We are thankful to our friends at the Department for Behavioral Health, Development and Intellectual Disabilities at the State of Kentucky's Cabinet for Health and Family Services for this information. Let's start by talking about recent national data. This data tells us that the suicide rate among males in 2020 was 4 times higher than the rate among females. In another course, we will take a deeper dive into the disparities of male and female suicidal ideation. For now, it is important to know that while males make up 49% of the population, they also account for 80% of suicides. To break that down even further, if we look at age-adjusted rates per 100,000, males account for 22 suicides per 100,000, and females account for 5.5 suicides per 100,000. So you can see the wide disparity among the genders in the national suicide rates. Because we are focusing in on suicide prevention among the elderly, let's take a look at those national data points. For people aged 85 and older, the news is not good. They, in fact, have the highest rates of suicide. Let's look again at the suicide rates for 100,000 people. Let's look by age. For 10 to 14, it's 2.8 per 100,000. For 15 to 24, it's 14.2. 25 to 34, it's 18.4. 35 to 44, it's 17.4. 45 to 54, it's 18. 55 to 64, it's 16.9. 65 to 74, it gets lower, it's 14.5. But for 75 to 84, it goes up to 18.4. And for those folks who are 85 plus, it jumps considerably per 100,000 and tops 20.9. These numbers speak volumes to the seriousness of this issue. So let's take a look at just what is behind these numbers. These numbers represent people. They are our neighbors, our family members, the other adults on whose behalf you work on a daily basis. They may be the very people you see on a daily basis and are not even aware that maybe something is troubling them that might be an individual risk factor. Just what are some of those individual risk factors that may be precipitating suicidal thoughts? Perhaps the person has had a previous suicide attempt. Maybe this person has a history of depression. Perhaps the person has a serious illness that may be accompanied by chronic pain. Another risk factor that might not be obvious is that the person has criminal or legal problems. The person might be having problems with a job or financial problems or losses. An individual risk factor might be if the person has impulsive or aggressive tendencies. Substance misuse is another individual risk factor. The person might have a current or prior history of adverse childhood experiences. A sense of hopelessness for an individual is also an individual risk factor. And finally, an individual risk factor of violence victimization and/or perpetration is included in this list. Now let's talk about relationship risk factors. These are behaviors, events, changes, or transitions that may be between two people. In this category, the risk factors are bullying, having a family member or loved one with a history of suicide. Loss of relationships is also a risk factor. If someone is in a high conflict or violent relationship, and this next relationship risk factor is a topic that has been top of mind in our country now for several years because of the circumstances during COVID. Social isolation or the lack of close, supportive relationships is a risk factor for suicide. Next, we are going to talk about community risk factors for suicide. Lack of access to healthcare. Think about how many people in our country lack access to healthcare. Another community risk factor is living in a community that's had a fair share of suicides. In other words, suicide clusters in a given community is a risk factor. Communities with rates of violence is another risk factor for suicide. historical trauma. For example, Indigenous and Native Americans, as well as Black enslaved communities, have experienced horrific historical trauma that has ripple effects on current and future generations. There is evidence that such historical trauma is passed through DNA to future generations. And finally, discrimination of any kind is a risk factor for suicide. Last, among the risk factors for suicide, we will be looking at societal risk factors. A societal risk factor includes cultural and environmental factors within the larger society that may contribute to risk. Among societal risk factors are stigmas associated with help seeking and mental illness, easy access to lethal means of suicide among people at risk, unsafe portrayals of suicide by the media. The risk factors we just discussed are for the general population. Since we are focusing these courses on the elderly, let's look at risk factors that are specific to our seniors. The first risk factor, social isolation, was mentioned before the general population, but for the elderly, social isolation and loneliness are particularly important risk factors. Older adults who live alone are more likely to be socially isolated and lonely. Being a widow or a widower, as many other adults are, is also risk factors for loneliness and social isolation. And finally, in the category of social isolation are those seniors who have low social support. Other risk factors for older adults are those who have physical and mental health problems. As we age, we are more inclined to suffer from chronic pain. The longer one lives, the more wear and tear on your bodies. For an older adult, stressful life events can precipitate risk factors. Some of those stressful life events can include financial discord, death of loved ones, friends, and even former classmates. Another stressful life event for an older adult is divorce. For an older person, the lack of autonomy, independence, and the need for home-based care or skilled care can be a significant risk factor. Finally, the loss of functioning with activities of daily living can also be a risk factor for an older person. Dependence on others to meet activities of daily living may increase an older person's sense of being a burden. Now that we've looked at the risk factors, we need to look at how do we protect against these risk factors. What are the protective factors against suicide? As in the risk factors, we will look at the different subsets of protective factors. Let's start with the individual protective factors. What can be done on an individual basis to protect against suicidal ideation? Effective coping and problem-solving skills. Reasons for living. For example, having family, friends, and even pets. A strong sense of cultural identity. Next, there are relationship protective factors. Using the interpersonal theory of suicide, these are ways that relationships increase our sense of being important to another person and our sense of belonging. Relationship protective factors are ways that those around us invite us to show up as our whole selves and provide care and support for when we are hurting or feeling alone. Support from partners, friends, and family, feeling connected to others. Then there are community protective factors. These are feeling connected to a community, school, and other social institutions, availability of consistent and high-quality physical and behavioral health care. Finally, there are societal protective factors. These are reduced access to lethal means of suicide among people at risk, cultural, religious, or moral objections to suicide. Finally, in this course, let's talk about the warning signs. It is vital to understand what these are in order to prevent someone from taking their life. Risk factors may increase the likelihood that someone experiences thoughts of suicide. Warning signs tell us they are experiencing these thoughts. For example, eating a Big Mac every day is a risk factor for a heart attack. Left arm pain, tightness in your chest, and difficulty breathing are warning signs that you are having a heart attack. Listen to them and be curious and non-judgmental. Hear what they are saying, listen to them talk. Here are some of the signs that they may be talking about: killing themselves, feeling hopeless, having no reason to live, being a burden to others, feeling trapped, unbearable pain. Also, they might be exhibiting certain behavioral signs that you need to be aware of, such as increased use of alcohol or drugs, looking for a way to end their lives, such as searching online for methods, withdrawing from activities, isolating from family and friends, sleeping too much or too little, visiting or calling people to say goodbye, giving away prized possessions, aggression, fatigue. You should also be aware of mood changes, and moodiness. Look for such things as depression, anxiety, loss of interest, irritability, humiliation, shame, agitation, anger, relief, sudden improvement. Lastly, in this course, let's look at the 5 action steps for helping someone in emotional pain. This is the best way you can help an older adult who is at risk for suicide. 1. Ask, are you thinking about killing yourself? 2. Keep them safe. Reduce access to lethal items or places. 3. Be there. Listen carefully and acknowledge their feelings. 4. Help them connect. Call or text the 988 Suicide Crisis Lifeline. 5. Stay connected. Follow up and stay in touch after a crisis.